All right, today exam and treatment areas. And the main goal is to prevent infection. So as we go through this, think of all the things we do to prevent it. So reduce the microbial count or eliminate microbial count. Maintenance. So equipment, supplies. Just notice that certain things are usually mounted on the wall. This table, you have access to one side, two sides, three sides, right? So you can navigate around the patient. There's different carts, multiple chairs. So you usually have the physician, the physician's assistant, the patient, and then sometimes if it's a child, the parent. So the rooms, minimal, 8 by 12. And for every doctor, how many rooms do they get? How many? If you were a doctor, how many exams rooms would you want? Just one? Two? Three? So usually there's two per physician. And that's because while the MA is doing something, the doctor is with the other patient, right? Like let's say this patient's taking vitals. So the doctor, after the MA takes vitals, the doctor then can see him. So if this doctor is now finished with this patient, the MA can then go over here and educate him. So this is what we found out. Here are the meds your doctor prescribed. So it's usually two, and then depending on the site, you can have other arrangements. So just make sure it's efficient. Patient comfort, that's one role of the MA. So to explain to the patient what's going on. For older adults, the elderly, what temperature should you have the room? What type of chairs should you have for the elderly? Right? So usually with arms. That way it lets them get up easier. You'll have stools, weight scale, so a bunch of stuff all in that exam room, 8 by 12. So you have to be very efficient with space and clean all the time in between patients and after shifts. American with Disabilities Act. Do you guys know how wide your doors need to be for wheelchair accessibility? How wide do they need to be? How about your hallways? Right? How wide do they need to be? Can somebody with a wheelchair turn around in your hallway? So I think doorways need to be 36 inches and hallways need to be 5 feet wide. That way they can turn. Disabled persons can turn in their wheelchair. Reasonable accommodations. So even at school, if you let us know ahead of time, we can make reasonable accommodations for anybody, any students with disability. So if you are deaf, then the school is responsible for getting an interpreter for you. Accessibility. So wheelchair ramps, whenever there's stairs, or bathrooms, right? Make sure you have the bars. And in some cities, if you renovate your house, regardless if there's a handicapped person or not, you're gonna have to install those shower bars and bars around the toilet. Sanitation. What's your guys' definition of sanitation? So all sanitation is lowering the microbial count. That's it. We're not eliminating. We're just making it enough where it usually won't cause a problem. So if the instrument touch healthy intact skin, all we got to do is sanitize it. So that's a quick wipe with alcohol pads. That is adequate for a lot of things. However, the next step after sterilization is disinfecting. Now disinfecting, we're bringing that count down even more, but there still might be some spores, bacterial spores. Do you know what they are? Have you heard of bacterial spores? Have you heard of anthrax? And in 2001 or whatever, when they were mailing the anthrax spores, right? So bacteria, when they can't live, there's like no food or the environment's too harsh, they go into hibernation. And what they do is they put this capsule around themselves that protects them. So those are the spores. And they're pretty tough. They can withstand temperature, radiation, desiccation. So even though we kill most of the bacteria, if they're spores, we may not kill them because they're so tough, right? They can survive on asteroids in space, right? Stuff like that. Then lastly, sterilization. And that's where we'll use high temperature and moisture to eliminate or destroy all things, including spores, right? So that increase in pressure and temperature will then destroy them. So here are some things that just need sanitation. They normally don't contact any bodily fluids or broken skin. But if they do, then you have to go to disinfection. But normal use, blood pressure cuffs, so ophthalmoscope for the eyes, otoscope for the ears, pen light, the hammer on your knee, the reflex hammer, stethoscope, tape measure, tuning fork. So things that aren't going to touch any biohazard substances, usually. Sanitation. So right after surgery, if there's blood, skin, hair, right, on the equipment, we have to get it off. Now, you have to get off all that biological stuff without causing it to stick more onto the equipment. So should you use hot, warm, or cold water? Hot, warm, cool, or cold water? Yeah, you just want to use regular room temperature, maybe a little bit warm. But if it's too hot, all that tissue is going to get destroyed and it might even stick on the equipment even more. So use a brush, neutral pH for the same reason. Now when we're doing disinfection, we might use something that has a high pH or something with a low pH because bacteria will get used to certain detergents and then it won't work anymore. So you have to switch your pH. But here for sanitation, we don't want to damage the tissue or further damage the instruments. Last thing you'll do is, of course, dry your equipment after you sanitize it. But you do not want blood to dry, tissue to dry. So in your sink, you might just have a basin filled with water. We'll put your instruments in there. So that's the first step. So if there's visible blood, we gotta sanitize first. Just scrub it off. Rubber or plastic items, you don't want to soak them. So for those instruments, you can put them in the basin, but rubber plastic, they'll break down, they'll discolor. So it's just a short soaker rinse. Ultrasonic. So in water, I'll put in the detergent. So there's a disinfecting agent, sanitizing agent, and we'll turn it on and it'll vibrate. And this is good for like instruments with little tiny parts where you can't really scrub them or they're delicate. If you scrub them too hard, you might break them. So you'll just put the instrument in, like the rotating head of an endoscope or something, and then you just put it in, turn it on, and that ultrasonic vibration will get into all the parts and help clean it out. Be careful. Some metals, when they come in contact and you vibrate them, they'll fuse together, and some will get damaged. So just make sure you're just using similar metals. No salts. Yeah, avoid salts because that's what's going to cause those metals to fuse. Disinfection. Follow directions. So there are multiple brands, types of disinfection agents. Make sure you follow directions for mixing and time. Contact time is very important. So one of the most common is like a bleach solution. So bleach solution, you need that contact time for it to actually disinfect. But you have to make your bleach every day, your bleach mixture, because the effectiveness of bleach disappears over time. So you got to make it every day. Now, so here are a couple items, or a few items that you'll need disinfection. And it's mostly glassware. So Elmerware is all the glassware you use to measure. Things go into the nose. Right? Is the nose sterile? No. You'll have bacteria, fungus, virus in there. Endotracheal tube, so down your throat. Is in your mouth down your throat sterile? No. But most likely it's not going to be infectious agents. So we just disinfect it, lower the microbial count. So here is an example of mixing bleach. And usually bleach, you're going to mix 10% solution, 5% solution. So if you have a 1 liter bottle, how much bleach do you need to add to make a 10% solution? What's 10% of a liter? Well, 0.1 liter, which is 100 mLs. So if your facility requires a 10% bleach, you'll mix it that way. If they require a 5% bleach, then you'll add 50 mLs to a liter total of water. Contact time, very important. If you just spray on the bleach and wipe off immediately, it did not have time to disinfect. Correct disinfection agent. So even with alcohol, 70% rubbing alcohol, which is isopropyl alcohol, we use 70% because it gives the correct contact time. If we use 100%, then the alcohol would evaporate too fast. It doesn't really kill anything. And if we use 50%, well, that's too much water. Then the water just stays behind, and that causes problems. So contact time is very important for disinfecting. Once things are disinfected, use transfer tongs to move them. That way you don't contaminate them after you just disinfect them. Next week, we will learn how to use the autoclave. So it's that tan machine there. So we'll learn how to wrap instruments appropriately, put in our indicator, and then we'll put it through a cycle. And when it comes out, when you open it, you always double check to make sure that indicator says things were sterilized. All right, prepping exam. So that was sterilization, disinfecting. No, sanitation, disinfecting, and sterilization. So just make sure things are well organized. If the reception area is bad, then most likely the back area, the back office, and the exam areas will look bad as well. So be clean. Are you guys familiar with how to use the alcohol-based hand sanitizer? So if you put on exam gloves and examine the patient, and then as soon as before you leave the room, you'll take off your gloves, and then you can use the alcohol base. So very important that you cover all areas of the hand with the alcohol, and that you let it dry naturally. Right? So you have to coat the hands, and then that contact time. A lot of people, they keep on rubbing their hands until it kind of dries, right? That's not the correct way to use it because it didn't have its contact time. So you got to cover all areas and then just let it dry. Right, make sure there's plenty of paper, linens available, and change them as needed. Disinfecting surfaces. So at the end of shift and then periodically. If something happens, a child vomits, somebody had an accident, make sure you clean it as soon as possible. Storage. Biohazard specimens, make sure you mark them appropriately. So usually if it's like a test tube or a vial or even some slides with tissue, right, you'll have it inside a biohazard bag so everyone knows. So transport them appropriately. So certain things you don't want to do in the exam areas: eat, smoke, chew gum, apply makeup, chapstick. So in this lab, same thing. You don't want to be putting on mascara, right? Adjusting your lipstick. You shouldn't be wearing that stuff anyways. Putting on powder, because that is going to be a source of infection. All right, older adults. Do they like it a little warmer or a little cooler? Yeah, they like it a little warmer because they lose muscle as they age. So they can't produce as much body heat. They like it a little warmer. How about for lighting? Do the elderly like it bright or dim? Yeah, so a little bit dim because their eyes become sensitive. Too bright, too much glare, it can cause them to get headaches as well. Lighting. So you have the hyperbolic light for exam areas, other lighting sources like the otoscope, thaumascope, and then the patient, or sorry, the doctor will have his pen light as well. So good lighting, less errors. Ventilation. Do you guys use Febreze? Yeah, it works wonders. Same thing in the office. You want it to smell nice and clean, like cleaning agents, not like bodily fluids. So one thing that causes a lot of problems are carpets. So it's more comfortable in a reception area, but that's where all the smells will accumulate. Maintain supplies, so just follow your ordering procedures. There's usually everyone's gonna be responsible. When you're low stock, just put it on the list. All right, some equipment. These are all pictured in your book. So anoscope for the examination of the anus, of course. Exam light, pen light, laryngeal mirror, just like the dentists use, similar. Nasal speculum, so anything that allows the enlargement of opening is a speculum. Ophthalmoscope for the eye, otoscope for the ears, and then the reflex hammer. Check the reflex in your knees, elbow, or abdomen. They'll use the hammer. What's sphygmo? Man is your hand, right? Manual, and this is to measure. So this is a manual measuring device for your blood pressure. So sphygmo is pressure. So a manual pressuring device. Steth means chest. Are you guys familiar with how to use a stethoscope? Do you guys know how to turn it on and off? Use the bell versus the diaphragm. Right? You know there's two parts, right? So the flat part is the diaphragm, and then the smaller part is the bell. Bell is for high pitch sounds. The diaphragm is for lower tones. So make sure, because there's actually a knob that will turn it to the bell or turn it to the diaphragm. So if you have it the opposite way and you're trying to hear, you're not going to be able to hear it all. So when you do your vitals class, just make sure you use it appropriately. Measuring device for heat, tuning fork for, of course, examination of hearing. Vaginal speculum, again, enlargement tool. So common trays, that's what they usually call it. So if it is a P&P tray, you'll know which instruments to take out. This one looks like just a general general exam tray. So they can specialize, and they just call them what you need. In week 3, we will practice on making a sterile field. So we'll learn how to lay out our sterile paper. So after we autoclave it, we'll learn how to lay it out. All of our equipment for surgery or for like wound care, stitches, etc. All right, general physical exam. Let's see what they got here. They got some curettes. You guys know what those are? It's for cutting. So they're kind of loop shape, but the cutting edge is on the inside. So I can put it in orifice and then I can scrape tissues if I need a sample. So that's what it is. Correct. Cervical scraper, similar. Cotton balls, needles and syringes, applicators, glass sides. So once you get your sample, we can put it on the slides. You can do a wet mount, or if you need to, you might have to stain it. You'll cover that in your laboratory courses. Gloves, definitely. Tissue paper, specimen, gauze, dressing, bandages. What else they have on there? Occult. What's occult mean? If you're in a cult, do you practice in the open or do you do it behind doors? Some cults do it in the open, but occult means hidden. So you can have hidden blood in your stools. So you might have to take a poop sample, smear it on a slide, and then do your blood testing. Tongue depressors. A lot of different equipment to use. Consumables. So fixatives for samples. So if you just have living tissue, it's going to start to break down. So a lot of these fixatives will dry out and preserve the specimen. For example, formaldehyde. You guys familiar with formaldehyde? right? They put dead bodies in it. But in the medical lab, we use a diluted solution called formalin, so it's not like pure formaldehyde. Prescription blanks, definitely. It's the controlled substances. Those prescription blanks are the ones that should be locked up. They must be locked up. A lot of times the RX only prescription pad, they just have them leaving out. But controlled ones, make sure they're locked. They have to be by law. Just general. Keep it clean. Keep your stock area clean. They'll show a little picture. All right, not too bad. Let's go over the personal protective equipment.